Prescription for Life is brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906-SURE.
Good evening and welcome. Good evening and welcome. Good evening and welcome. Welcome. You are good evening. This is Prescription for Life here on the Nationwide 90 FM, brought to you with the kind support of Suretime Medical. You can find them at 10 Trafalgar Road in New Kingston. You can call them 394-5433. You can call them also 906-7873. And as I said, you can pull up 10 Trafalgar Road, New Kingston, any time of day, any time of evening, any time of night, any day of the week. Public holiday, Sunday, doesn't matter. It's open 24 hours and there's someone on the other end of the telephone whenever you call to help you to find your way back to good health and to restore your sense of well-being. The man of the hour is with me. He's wearing yellow this evening. Not sporting his Arsenal gear this evening. Arsenal still doing well, still leading the English Premier League. The man with the answers, Dr. Andre McDonald. Good evening, sir.
Yeah. Yellow has very powerful meanings, George.
Yes, it does.
Very powerful meanings. I will go through the colors on another program.
Yes, sir.
So that I'll tell my listeners and patients what to wear at what particular time.
Excellent, sir. Excellent. I'm sure you have a coat looking like Joseph's because you're a natty dresser. There you go. Doc, I want to say that the 24-hour lifeline for Short Time Medical 394-5433. I had cause to give it to a friend of mine who called me in an emergency situation. Today is Tuesday. He called on Saturday. Panic. He needed that number. And I just reeled it off to him and I sent him the 906-7873 for good measure. So I'm sure our good friends at Short Time treated him and his issues very well. All right. Doc, this evening we're talking about coronary artery disease. It's the same thing that I'm sure people call the coronary heart disease. But I leave definitions to you.
It is more specifically so in women, George, a patient of mine, I want to say a patient of yours, yeah, very good friend of myself, who the first time she saw me, she asked me, "Where is George?" We're going to call her patient A for now.
Yes, sir.
You know, she walked into my office and her first question was to ask for you, you know, even though she had a medical concern, because she listened to you and only came into the office because of something you said.
Oh.
Yeah, she said we were talking about the heart, as we do on probably almost every program because it's such a critical part of the body. And you were talking about how people with heart disease present. And on that particular day, you were talking about the less than typical symptoms, the atypical symptoms, not the ones that will stand out.
Yes.
And so, even though her presenting complaints were mildly swollen legs and shortness of breath, and she just noticed that she was just tired all the time, had fatigue, in addition to having what you call dyspeptic symptoms, some peptic ulcer disease, what Jamaicans call ulcer stomach.
Yes. No, Doc. I've told you already. Ulster stomach.
Thank you
Ulster
very much.
stomach,
Thank
yes.
you very much, George. She presented with that, had also a little elevated blood pressure, but she had no classic chest pain. No classic chest pain. Every time you would ask her about her chest, she would tell you, say, well, I may have a little discomfort here or there, but there was nothing classic. Those were the symptoms she presented with. But she came in because she has been going to the doctor for years, a woman who is more than 50 years old.
Yes.
So she has seen her fair share of the doctors change stuff. She told me she was with her last GP for over 5 years.
Yes.
And all those years, she was treated for circulation problems in the legs. She was treated for peptic ulcer disease. She was treated for a lot of different things. She had a cough also, and she was on asthma medication. So she came in a whole host of medication, was told that her blood pressure was mild, so she never really needed to look at it much. But when she came in, she had a picture that rose our index of suspicion, because the lady heard something you said.
Yes.
And when she walked in, she more than helped us because she said, boy, because of what I hear last night, I want to check my heart.
Yes.
George, true story. The lady was investigated with an ECG. And when we did the ECG, it was abnormal, had some changes. Never had what the nationwide listeners are going to learn about tonight called ST elevation changes. Big thing.
Yes.
Bright listeners for nationwide. And they want to remember ST elevation because we are going to ring it throughout this program.
Yes.
It never had those changes. These are changes doctors look for to say somebody is having a heart attack.
Yes.
And we never saw those changes. And then we did something called cardiac enzymes. Cardiac enzymes is what increases in the blood when heart muscle is damaged. Damaged heart muscles release cardiac enzymes in the blood.
Yes.
There's one called troponin. And so when you hear people say they're going to do a troponin test and an ECG, we're trying to see if this person has had a heart attack.
Yes.
George, all of them came back negative. But remember, this lady had a high index of suspicion for herself.
Yes.
And based on what she heard you say, she decided to come in and check.
Yes.
We looked at all our symptoms and we ourselves had a very high index of suspicion, especially because of the fact that all these medications she was getting just wasn't working. And we called the cardiologist. He came in, took the echocardiogram machine. We decided to do an echocardiogram on her. Lo and behold, George, her heart was functioning at less than 35%.
Wow. You said she was over 50.
Yes. Yeah. And what is more amazing is that we decided, Judge, that we were going to send her to a hospital for some further investigation. Some of the investigations we'll talk about tonight. Because we now realize that she also had symptoms of heart failure, which was where the swelling of the legs were coming in, and we saw other things on the lungs, which is the reason why she was having the cough. And we decided that she needs further investigations. So we sent her. She spent a couple of weeks in hospital, and she has been back and forth a couple of times. And every time she comes, she will ask for George. Had to admit her recently again. The sad news, George, is that last week she died. She died in the hospital. Never forget, she would always ask for you. And her family members who are listening right now as we speak, has given us permission to use our story to bring light to a very important situation. It's heart disease in women, which is frustratingly undiagnosed, undertreated, not because the doctors necessarily miss it, but the symptoms are usually not the big telltale chest pain symptoms that you want to see.
Yeah, I'm not cutting it up, but that's such a critical thing for me because we've been doing, I think this is probably the third topic we've been doing in as many weeks, where you've been speaking much about the classic signs of a headline problem not being visible.
Yeah.
And the doc is scratching his or her head saying, then what is the issue? Because a test for this, a test for that, I run this test, I run that, I do this examination, and I can't find so, but the patient's still sick.
And the patient is getting sicker.
Yeah.
Because when we finally made the diagnosis, her systolic function, that's what we call it, was less than 35%. When the cardiologist found her, women in general present 10 years later than men with heart disease. Women in general die more than men because of their later presentation, and when they present, they usually present with a higher risk burden, with the hypertensions and the high cholesterols and the diabetes. So the risk factors are greater. It's not that the doctors want to miss it.
Yes.
Is not that the women want to miss it, because women in this country attends the doctor 22-1 when it comes to women versus men.
Yes.
So why is it that women are dying more from heart disease and they're presenting later and they're underdiagnosed and undertreated, not only in Jamaica but worldwide?
And well, I'm happy you said worldwide, because I'm just going to interject to say, I can imagine some people saying, well, maybe it is that we don't have the equipment to test for these symptoms. That's not an issue.
That's not the issue. it's worldwide, and this a lot of the figures I'm going to give you today, both worldwide and local figures, but the worldwide figures are worse.
Yes.
So it just goes to show you that this is a problem. Even in the first world countries, a lot of the figures will come from the CDC, Centers
Yes.
for Disease Control, which will quote some American figures.
Yes.
And the problem is terrible there, where they have the most up-to-date equipment.
Yes.
And it just goes to show you that at the end of this program, it is for women and healthcare providers to just have a higher index of suspicion.
Yes.
It can't hurt for you to do the test. It's better for it to come back negative, George, than for you to leave it and not do it and it's positive.
And for the men who support the women, don't forget that we're very important in encouraging our women to go and get these checks done. All right, we have opened. That's our opening salvo. A hostile innings if we were playing cricket and we were bowling. And Doc is coming back. A lot of runs will be scored after this break.
Suretime Emergency Medical Services, your 24-hour ambulance emergency service and medical center. Visit us at 10 Trafalgar Road, Kingston 5, or call us at 906-SHORE. That's 906-7873. For ambulance services, medical coverage at events and medical house calls. Make your appointment today. Suretime Emergency Medical Services. Worry less and live more. Call 906-SHORE.
Back with us on Prescription for Life here on Nationwide 90 FM. My friends at my friends at Suretime Medical have asked me to remind the listeners that the Super 7 is up and active. Remember, we're coming out. Today's the last day of the month. So today expires the 2-for-1 special that Suretime Medical were running for the month of February, the month for lovers. The Super 7 suite of checks involves heart tests. And it's very important that you note, especially for the women, that the Super 7 suite is so affordable that you can get the tests done, a range of 7 tests, and in it with the crucial heart tests you can get, and as Doc has painted in his opening salvo, crucial for women, especially those over a certain age, to get those tests done. All right, Doc, let's get right into it now. A quick definition, just to break it down. Coronary artery disease. So you can leave disease alone. What's coronary? What's artery?
Yeah, it's just the artery that gives oxygen and blood and nutrients to the heart. In general, these arteries can become blocked. So the disease, or dis-ease, as a former lecturer of mine would say, is where the arteries become narrower and narrower over time.
Yes.
And what we see happening, George, is that normally people eat fat and stuff with cholesterol, and they pay no attention to it and probably do not care and don't think it is going to make a big difference. From they are very young, George, from their children. And
Yes.
when you're a child, from you're young, these things start depositing in the arteries.
Yes.
How the body works in general is that this cholesterol and this fat is foreign to the body. So what the body tries to do, George, is eliminate it.
Yes.
The same way how the security forces will try to eliminate a threat.
Yes.
And while they use their weapons, inflammation occurs. Yes? Things and people get damaged.
Yeah.
It's the same thing that happens in the heart. When the body tries to rid the cholesterol and the fat, inflammation occurs. And in order to ensure that the inflammation doesn't spread to the point where it damages the heart and the blood vessels, the body tries to seal this off. But by sealing the fat and the cholesterol onto the arterial surface, it starts to grow like a bump. And it grows. And every time a little fat and cholesterol deposit on the body seals the inflammation, it grows. So you can imagine that the lumen, or the opening of the artery, has started to become compromised.
Yes.
It's not that wide anymore.
So that is that build up that makes the artery narrow.
That build-up makes the artery narrow. And what is even more now is that the artery has the ability normally to expand
Yes.
under certain conditions, because it can expand to facilitate more blood flow or even contract. That build-up stops it. It interferes with its pliability, its ability to bend and expand and contract. And what happens over time is two things, George. Two things can happen. Either over time, years, it just blocks off the whole artery, or it partially blocks the artery, and that little build up you see, that bump, it fractures, it breaks off. And that piece that breaks off can go further downstream and block a smaller opening. We call that piece an embolus. Yeah. And it can even go up to your brain and cause a stroke, not only a heart attack.
Yes.
But it can cause a heart attack by blocking a smaller artery, or when it breaks, a clot forms.
Yes.
And that clot immediately just blocks the whole artery.
Yes.
The thinking is, George, that if the artery is blocked, then no nutrients cannot get behind the blockage.
Yes.
No oxygen will get behind the blockage.
Roadblock, no traffic beyond the roadblock.
There you go. And the road beyond the block is said to be ischemic. Ischemia is just a word that means no oxygen.
Yes.
And if the heart muscle is not getting any oxygen, it dies.
Yes.
That defines a heart attack.
Yes. Excellent. All right. Let me take a stab at the dark here, because you spoke about women and their susceptibility to coronary artery disease or coronary heart disease, one and the same. And there's a natural question that emerges in my mind, at least, and it concerns an orgasmic response in women and the matter of them having coronary artery disease or being on the road to that. So the question I'm asking is there a relationship in the presence of coronary artery disease at whatever level and it acting as a roadblock to the achievement of an orgasm, and why would this be so, if it is so at all?
Yeah. So you have asked a perfect question, a wonderful question, and that question was asked just like that, actually, in a medical journal.
Ooh.
Would having heart disease in women or being susceptible to a heart attack interfere with the ability of a woman to climax?
Yes.
Or would having the heart disease put a woman at risk for having a heart attack when she climaxes?
Yes.
Yeah, it's a good question. It was asked both ways, and both ways the answers are yes. Because somebody, and this happened in both women and men, this study was done, if you have chest pain and you are going to initiate any action at all out of fear, you will stop. And so you will find out that some women, even men, even to continue the process, they will halt on the process because they started to have this feeling of impending doom, heart attack, panic attack sort of feeling. So it causes you to pull back out of fear. The other thing we found is that if your heart, because the whole process is like moderate exercise,
Yes.
if your heart is severely compromised enough, as I would have given a story the last program we had when we spoke about the heart and penile disease.
Yes.
The patient that I saw years ago in the A&E unit actually had a heart attack just after he had gotten to the mountain. He just never came down.
Yes.
So it's a very important question to ask. And you ask the question the other way, which was also important because the studies recognize that out of fear,
Yes.
people may not get to where they want to go.
Before we get quickly to ST elevation, I have to ask you about the race profile, just dipping into the risk factors. And if you mentioned that you'll be giving study figures, facts and figures from the CDC, overseas, Centers for Disease Control and Prevention.
Yeah.
Of course, the number of Caucasian women in the United States, of course, is high.
Yes.
Several millions, perhaps 100 million, if as little as that.
Yes.
What about black women?
Right.
Is it that black women are more likely, or Latino women, or white women, or women of another race are more likely to present with or be troubled by coronary artery disease?
Black women are much more likely, 47 to 36% against CDC figures. 2 out of every 3 black women will be laden as how they described it in a paper that they written with risk factors. They will have the high blood pressure, the high cholesterol, and the diabetes, even more so than Caucasian women. And apart from coronary artery disease being the most common type of heart disease is still the number one killer of women in general.
Yes.
Again, killing more blacks than whites. Every 40 seconds, George, somebody dies of heart disease. It means 90 persons from the start to the end of this program would have died by the time we're finished. It is responsible for 1 in 5 deaths. 1 in 5 deaths. And it formerly was believed to be the disease of men or older women. Now, George, you will know that young women are dying even more than older women because of misdiagnosis. We're twice as likely, 41 to 24%, to miss a young woman's heart attack than an older woman. And it's because her symptoms are even milder. Very, very important. The CDC even went on to say that 47%, 1 in 2 persons, will have one of the main 3 symptoms: hypertension, high cholesterol, and smoking, that is responsible for heart attack. And black women tend to be way ahead in this.
Yeah.
Way ahead.
You spoke about young women. Did they give a number as to, okay, once you've approached this age women, you need to be on the P's and the Q's?
Yeah. So we said 1 in 9, very important, 1 in 9 between 35 and 65 is the figures that they're giving, right? And this is because below 35, the presentation, even though we know that many persons are coming with a chest pain, we realize that below 35 years old, young women, they're so underdiagnosed that when they present with chest pain, you can imagine a woman presenting at 20. The chances of the doctor even doing an ECG, and this was the challenge with many of these studies when they visited GPs, and they asked how many of you, which is where the young woman presents, because she'll never present to most of the times not to the hospital or not to the specialist. A woman presents at a young woman, 20 odd, with chest pain. How likely are you to do an ECG? How likely are you to do a cardiac enzyme? Almost none of the time. And that is the issue. So remember, we don't only have a challenge of undertreatment, George. We have a problem with underdiagnosis. And this is the huge reason why the figures were shown that a young woman is twice as likely not to be diagnosed than an older woman. You see an older woman, you say, okay, let me do these things.
Right.
So my patient over 50, let's do it. When she was much younger and going to the doctors, it probably wouldn't have been thought about.
Do the studies say whether this thing, coronary artery disease, has ever killed women in their 20s in significant enough number to be informational to the study?
Oh, definitely. Women under their 20s would have had would have died because of myocardial infarction. There's no doubt about it. So many young women are indeed dying because of myocardial infarction. Now you have to be mindful that it's not as many as the older women, because coronary artery disease that we're talking about will be something that takes a very, very, very long time
to develop.
Yeah.
And just before we go to the break, let's sneak this one in, because I'm sure people are wondering, why is it so deadly for women but not for men? Can you do that in 90 seconds?
Yeah, I can tell you. It's deadly because of the atypical presentation that we're going to be talking about when we come back after the break. And it doesn't present the way men present, and it presents later than men. So it is deadly because it's often missed. And by the time the women present, they present like my patient with 35% sometimes of their heart gone. That's the issue that you face. And then you end up with too late being their cry.
Too late being the cry. Let's not be too late for this break. We're on Prescription for Life, brought to you by Suretime Medical. Break time. Back with more after these. Back with us on Prescription for Life here on Nationwide 90 FM. Doc, scratch that one before we came back. All right? I'm just saying, all right? Just work with me, all right? Good.
Yes, sir.
Let's get right. Abridged into the risk factors. You promised at the start, and I'm holding you to your promises.
Yeah.
The issue of ST elevation. You said it was very important, and I want to know why. What is this ST elevation? What's the significance of it?
It's going to you want to and the listeners want to know, and I like the listeners of Nationwide because it's so important that you understand in the investigations that we're going to come to. There's something called an ECG. And you hear George talking about this ECG all the time and come to do your ECG, and we spoke about a big word, how it happens, the pathophysiology, how it happens. That's all that big word means. So George asked me earlier, how does coronary artery disease occur, and we spoke about it. What happens, George, is that when you're looking at that ECG,
Yes,
the doctor looks for a number of things. There are waves and lines on the ECGs that we even name it using letters of the alphabet, like P, Q, R, S, T, U. These things we use on the ECG. And while we are looking on these lines and these waves, that line between S and T drawn on the ECG, the doctors look because during a heart attack, especially a specific type of heart attack where all of the blood vessel is blocked.
yes,
All of the blood vessel is blocked. And based on where you see it being, you look on that line where all of the blood vessel is blocked, you can see that ST line jumping above a base. So you expect it to be normally on this level, but it is higher on the paper. So we call it a ST elevation.
yes.
It's very important that doctors look for that, as they do all the time. Probably one of the first things they look for. And they look for where that is present on the ECG because it can tell them the specific place in the heart where that clot may be.
Yes.
The thing about ST elevation is that it happens when the entire vessel is blocked. So doctors will look at the ECG and say, yes, I see a ST elevation MI.
Yes.
Remember, MI is myocardial infarction.
Yes,
we even have a name for it, to call it a STEMI.
Yes.
And I was, not mildly surprised, but a lady came in to me the other day and I was looking at her ECG and she said, Doc, do I have a STEMI? Because she had chest pain.
She read up.
She read. She read. It's very important that as a doctor you know because your patients are reading.
Yeah, man.
The thing about STEMIs is that because the entire artery is blocked when you look and see a ST elevation, you would understand that the muscle behind that blockage would have been devoid of oxygen because it's totally blocked.
Yes.
And then that dead muscle is going to release cardiac enzymes.
Yes.
So when you do the ECG and you see the STEMI, and then you do that blood test to look for that cardiac enzyme, most commonly most popular one we call troponin.
Yes.
Yeah. There are others, but most common one troponin, because that one rises quickly. You see elevated troponin and you see ST elevation, you know this person has had a major heart attack. And this is why we want the listeners to understand that. But it is even more important because while STEMIs kill more,
Yes.
9.4% to 4.9%, very important. It kills more. It is a more major type of heart attack.
Yes.
Non-STEMIs, which are much less, as you said, 9.4 to 4.9, 4.9%. Non-STEMIs mean there's no ST elevation. It would mean to the nationwide listener that the artery is not completely blocked. Not true. And it means the muscle behind it is not going to be dead also. So here it is that this lady was exercising. The artery wasn't completely blocked, but because she was exercising, George, like you spoke about, let's say she was just doing a simple exercise, sexual intercourse.
Yes.
The oxygen to the vessel is much less
Yes.
because the oxygen is gone into our muscles. It's gone into the blood flow, is gone into making the clitoris erect.
Yes.
So she's losing oxygen and blood in other places.
Yes.
And when you're exercising moderately, the musculoskeletal system can take up to 88% of your blood supply.
Yes.
You leave the poor heart to struggle. And even though it was compromised, meaning it's not totally blocked, but it's almost blocked.
Yes.
When the blood flow drop and the oxygen drop, it behaves like a heart attack. So you start feeling chest pain.
Yes.
So you stop. You said it earlier and you answered the question. So you stop now your exercise,
Yes.
whether it is any type of exercise, because you now feel it's chest pain, which happens in a lot of people drop off the treadmill with chest pain.
Yeah, man.
We're called every day to different gyms because people drop down while exercising. Here it is, George, that with this now, the patient rushes, comes into the office, and we do an ECG on the chest. And they have all they have symptoms of chest pain, but we look, and when we look on the ECG, we don't see ST elevation, because when the patient stop exercising,
The body's at rest.
thank you,
Everything normal.
and the blood rushes back.
Yes, yes,
The blood
yes.
rushes back. It doesn't mean the heart is still not compromised.
Yes.
It doesn't mean the person is not in trouble.
Yes.
We do the troponin and it's negative, right? What many women do is that this will happen to them. They don't come and visit the doctor. Don't give us a chance to look at the ECG. Don't give us a chance to do serial ECGs and serial enzymes, meaning put them to lay down, and do it later on to see if anything has changed. The thing pass and them say it's just some gas.
Yeah.
And nationwide listeners want to understand that while that non-STEMIs are more common than STEMIs,
Yes.
non-ST elevation, myocardial infarction are much more common than the ST elevation ones. So George, the reason why we have to talk about this is because you get a false sense of security.
Yeah, man.
The chest pain come,
Yes.
and it goes away.
Yes.
You go sit down, and later on in the night, here is the bombshell. Ladies who get heart attack, females, while the men's heart attack tend to be brought on by exercise more, the ladies, their heart attack tends to be now brought on in the night when they're asleep, at rest, when they got a early one during the day,
Yes.
go to sleep in the night, and in the middle of the night, boom,
Yeah. Disaster strikes.
disaster strikes.
Yes.
That is
All right.
why it's so dangerous.
If there's anything you want to query on this issue, there's place for you to call 630-9371, 630-9372, 630-9373, 630-9374, or 618-8255. If you're feeling a sense of doom or you're just inquisitive, we cater to all types. You are invited to give us a call, and Doc will explain to you. All right. So what is it about lifestyle and diet that exposes one or elevates one's risk to the matter at hand?
It's probably the most important question, George,
Yes.
of the program.
Yes.
Because you asked me how it is that coronary artery disease occurs, which is the foundation of a heart attack.
Yes.
It's the most common cause. It's the most common cause of heart disease. The foundation of that is plaque formation in the vessels.
Yes.
The foundation of that, George, is cholesterol and fat. The foundation of cholesterol and fat causing inflammation is your diet, what you eat. So you have to decide whether you would like to eat the skin of the chicken, whether you would like to eat the back of the chicken, whether you would like to eat the foods that run on the bottom of the sea. We call them bottom dwellers.
Yes.
Because they're high in cholesterol, specifically LDL cholesterol, low density lipoprotein, in other words, bad cholesterol.
We've spoken about that here already.
Yes, you have to decide whether you want to eat trans fat. A trans fat is created in your frying pan
Yes.
at 362 degrees Fahrenheit, which the pan gets to very quickly.
Yes.
And you have to understand that even if you throw olive oil in that frying pan, it will create a trans fat. Yeah. So you now need to say to yourself, once you fry anything, and the Jamaican love their frying pan. Yeah.
If we could have fried water, we fried.
That's it. I mean, you cook the food in the night and you get up in the morning and fry it over.
Yes, sir.
You know, I was giving a talk in, I think it was Barbados or Trinidad, and I was telling them how much the Jamaicans love to fry, and we will cook our dumpling, boil it in the night.
Boiled fried dumpling is the sweetest thing in the world.
And we fry it over the next morning.
Yes.
You are creating trans fat, saturated fats, the foods that we love. So all the common fast foods that are consumed on a daily basis.
And the pigtail on the Wednesday of the stew peas, Doc. Don't forget that one.
We will not forget that one. You have to decide if that's how you want to consume. And here it is. Remember, CDC spoke about the big risk factors. We know that primary smoke is significant, but secondhand smoke is deadly.
Yeah.
And a lot of persons, a lot of women have gone home with heart disease because their husbands are smokers.
Yes.
You have to talk to your husband. Hypertension is now 59. You know, when I remember giving my first presentation on hypertension as a medical doctor. Hypertension was 1 in 4 in Jamaica. I remember following that, George, it became 1 in 3. Mm-hmm. Now we're at 59%. 59%. Hypertension is almost 2 in 3 individuals in this country and worldwide. Hypertension is just increasing as the day. Hypertension is a big risk factor. High cholesterol, hypertension is a big risk factor. Diabetes is also a significant risk factor.
Yeah. All right.
And so it is up to, those are the risk factors that you ask about.
Yeah. There are so many things which give you fill you with a sense of dread that you're effectively eating yourself to death of some form of major disease by virtue of the diet you choose to have. I mean, because most of us can help ourselves. We choose to eat the way we do, and people say, "Lord, eating healthy is expensive." Not really. You eat the right things, you'll be okay. Yeah, there you go. All right, because as you know, the burger and and things like that. They are worse. You know, Doc, as I go to the break, I had my first burger when I was about 16, you know.
So believe me, George, from probably then or before, your coronary artery disease had started.
There you go. All right, we take a break. Our final one. We come back with more Prescription for Life here on Nationwide 90 FM. $3,500 for the Super 7 suite of tests at Suretime Medical. That includes, wait for it, the ECG test, which could prove the difference in the short and the long run. Back with us on Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of Suretime Medical. They're at 10 Trafalgar Road in New Kingston. You can call them anytime, 394-5433 or 906-7873. They are running from March 1, well, from today, Super 7 suite of tests, only $3,500. Now, for $3,500, under normal circumstances, you go to Showtime, you can see the doctor for the cost of $3,500. But you can go with the same $3,500 and tell them that, well, rather than just see the doctor, I want to pay for the Super 7 suite of tests with this $3,500, and they'll oblige you because that's what it costs. As cheap as that. And it's not cheap, it's cost effective, yeah? Because cheap suggests subpar quality, suggests corners are cut. No corners are cut at Showtime. It's exemplary service, but they recognize that, you know, those of us with health challenges, we aren't all deep of pocket, and they advertise these services and provide these services at a rate that a reasonable person can afford. And so for only $3,500, you can get a suite of 7 tests done, including very important ECG test. Doc, we're in a unique position. We are in the dying embers of the program. We have a lot of ground to cover. We will not rush this topic. We can advertise from now to our listeners that we'll be back next week, Tuesday, picking up on this topic, because I know that there are so many more risk factors for you to go through, and I would hate having to squeeze all of that and more in the remaining 10 minutes of this program. So let's tell the listeners that next week we'll have the second edition of coronary artery disease, and so for the rest of this time, let's pick up on those risk factors.
Diabetes is such an important thing to talk about. And thank you for the time, George, because diabetes is one of the reasons why many women present with a silent myocardial infarction. 1 in 5 MIs are silent or is silent, if you want to say it correctly. One
That
in
is it.
five is silent, George. And therefore, silent by definition means there's few or no symptom at all. How we find it out is that the patient comes in with other things. But while we're testing, especially when a patient comes in with chronic illnesses and they come into us, myself or the doctors on duty would request an ECG and a troponin. Because, and remember the troponin by now, the nationwide listeners understand that's the cardiac enzyme. And so that is requested along with many other tests, which we will learn about when we talk about investigations next week. But these are requested as routine depending on the presentation of the patient. And many times the troponin comes back elevated and the ECG comes back abnormal, whether or not it speaks to ST elevation or not. But some of the time it comes back with other things that we find in women with heart attack. For example, left ventricular hypertrophy. One of the big risk factors for heart failure and presentation with women is left ventricular hypertrophy, or something we call a left bundle branch block. It's something that the doctors will see every day, and when we look, a woman will come in and she may not present with this ST elevation that we spoke about, but the left side of her heart is enlarged, many of the times, George, because she has been hypertensive for so long. Some of the times it's enlarged because the woman may already be in some sort of heart failure.
Yes.
Some of the time it is enlarged because she was born with a sort of heart disease that causes it to be enlarged.
Yes.
And all of these things put her at risk. So we look for these things. These are very important things. And these things will put a woman at risk for heart failure. My patient would have been one of those candidates. I want to tell you that diabetes, women who presents with diabetes and some sort of symptom, which we're going to be talking about again possibly next week, that suggests that there is heart disease, usually are 3 times likely to have heart failure.
Yes.
And so diabetes puts another dimension to the presentation of women because they tend to present silently. And many diabetics, their myocardial infarction or heart attack presentations are missed worldwide. That's one of the big things that the studies present.
Yes.
That a woman, especially a diabetic woman, you must always have a high index of suspicion. In other words, diabetic women will come to myself and many doctors in Jamaica with a very simple presentation, and the presentation is that their head is hurting, them have pain in them neck, them feel bad or them feel weak.
Yeah.
George, nothing to do with chest pain, nothing to do with pain radiating down left hand, nothing like that.
None of the classic signs.
None of the classic signs, just bad feeling.
Yes.
You know, my stomach, I was eating my lunch today and my stomach feel upset. In my time as a medical doctor, I can clearly remember at least 5 patients who presented like that. And when you investigated them, they had elevated cardiac enzymes and an abnormal ECG. Abnormal enough to be referred immediately to the cardiologist.
Yes.
And this is something that women must understand, especially diabetic women. The young women, George, which is a big point, tend to now be having what we call metabolic syndrome. Now, we have spoken about metabolic syndrome. A lot of women wear a big waist circumference, and many of them would agree that the obesity is a little bit more attractive than it used to be then, and so they wear it for fashion.
Yeah.
But metabolic syndrome is where your waist circumference is 36 or more. You have elevated blood sugar, elevated blood pressure, and elevated cholesterol. And what that does is that puts a woman at risk for heart disease and type 2 diabetes. It's not something that you want to have happening, because one study said that the reason why many young ladies are now presenting in even a worse position than older ladies is because of metabolic syndrome and how they carry themselves with this overweight picture.
Pause for a cause, Doc, because Anne wants to pose a question to you. Good evening, Anne.
Good evening. Dr. McDonald, just wanted to know if bradycardia is a prerequisite for heart failure.
Yeah, well, that's an interesting way to ask the question. So the answer for the straight answer to your question is no, it is not a prerequisite. But bradycardia is where the heart is beating slowly. So for the listeners, normally the heart is supposed to beat between 60 and 100. Bradycardia means we're less than 60. The truth is, many persons can have a heart rate between 50 and 60 because they're fit. For example, they're athletes. And we don't see anything wrong with that because it is okay. Many persons have bradycardia now because there's something actually wrong with the heart. So it's a good point, and many of the times when ladies come in, like my patient, and many of them who come in with heart attacks, one of the things we see is bradycardia or slow heart rate. And that is because the heart attack hits them somewhere that is responsible for causing the heart to beat. There is something in the heart that Anne might know called the sinoatrial node that we have spoken about here before, George, which initiates the heartbeat. It causes the heart to beat. And sometimes the heart attacks that people get will affect that. And some of the times, the heart attacks are so bad. A patient that I had recently, 80-year-old lady, she came in with a heart attack, and when we got her heart was beating at 34 because that particular place was hit, and it's another place in the heart that would have been taking up the beat because that place was knocked out. And so we call the cardiothoracic surgeon now, my cardiothoracic surgeon that works along with me, and he put in a pacemaker.
Yes.
That allowed her to get the heart to be beating. You're right. If we allowed her heart to continue beating at 34, it would have failed. But we were able to correct it. But not all the time you see slow heartbeat or slow heart rate, it means the heart is going to fail.
That satisfies you, Anne?
Yes. Okay, thanks. Does the pain, it could bring pain?
So
if you're going to have a heart attack from bradycardia, it could be painful or not necessary.
No, man, it can be painful, man. But the point we're making, especially next week now, and when we talk about the symptoms, is that the classic symptoms in 2 out of every 3 ladies is not the classic chest pain. That's one of the things. One study say up to 70% of ladies will not present in the classic way. And therefore, they might not have the pain. But yes, we do see ladies who present with bradycardia, slow heart rate, and chest pain following a heart attack, yes.
Okay, thank you very much.
You're welcome. Thank you. Doc, we're almost out of time, but there's one question I wanted to ask before we go. Earlier you spoke of the blockage, and we used the example of the roadblock and saying, well, the road was either partially blocked. So on the other side of the roadblock, not enough oxygen is getting to the heart. And then he spoke of the problems that germinate from that. But given the heart's, I don't want to say fragility, but the delicate nature of the heart and the important role it plays, the critical role that it plays, is it oversimplifying to say that any damage to the heart is irreparable? In other words, things like those are blocked arteries that reduce or constrict the supply of oxygen. Even if treatment is applied early enough and that artery is the plaque gets removed, or those arteries, the plaque gets removed, and the artery is able to accommodate blood flow as normal. Is it that the damage that would have been done to the heart before, in any small measure, that damage is irreparable?
It's not. It's not. It's an excellent question, George. It's not. And for the listeners of Nationwide, thank you for that. When we talk about treatment next week, we're going to be talking about some times. We're going to be using 3 hours and 12 hours. The listeners will remember, because we're going to tell you how quick you need to attend to certain types of blockages before they become permanent and irreversible.
Hear you on that. All right. So we're out of time, listeners. Just to remind you that Suretime Medical, they are responsible for this program, A Prescription for Life. You can find Suretime Medical at 10 Trafalgar Road in New Kingston. You can call them 394-5433 or 906-7873. And don't forget their Super 7 suite of tests. That's a staple at Suretime Medical. You can get that Super 7 suite of tests for only $3,500, and that's the constant deal that you'll get from the very good folks at Suretime Medical. Next week we will continue looking at coronary artery disease, and Doc will tell you even more about why it is so deadly for our women. Good evening.
Prescription for Life was brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906-SURE.